Hi, I'm Dr. Heather Hirsch, and welcome back to my YouTube channel, Health by Heather Hirsch, where we talk about all the important topics in perimenopause, menopause, and hormone therapy. And today we're discussing two different types of transdermal estrogens, patch versus gel. Which one is right for you? I'm going to give you all of my thoughts, break it all down, risks, benefits, pros and cons. So if that's something that you want to learn about, something that you're going to be discussing with your doctor, stick around. If you don't know me, I now have a private telemedicine practice after founding the Midlife and Menopause Clinic at the Brigham and Women's Hospital and working as faculty at Harvard Medical School and writing my own book, Unlock Your Menopause Type. I now see patients in my private telemedicine practice right here in the comfort of my home office. This practice has also expanded to include more clinicians in more states, and I'm going to drop the link below if you want to see an expert elite clinician, have hour-long visits, and get expert precision menopause care. When it comes to the safety of hormone replacement therapy, there's one thing that we know about transdermals is that they do not increase the risk of blood clot. And this is one of the big myths and fears that many clinicians who are going on outdated, biased information will try to tell you to scare you from starting on hormone replacement therapy. Now, I have many videos here on YouTube all on the safety of hormone replacement therapy, the cardioprotective benefits, and more. So if you're still stuck there and you're not already at the stage where you are planning your hormone therapy regimen, go back and watch a few. That's gonna make you feel really confident about your HRT regimen. And then we're going to get into what's the best transdermal option for you. Now, this doesn't mean that I don't ever prescribe oral hormone therapy. I actually do all the time. I think in my practice, I probably have 40% of my patients on the patch, 40% of my patients on gel, and about 20% of patients on oral. So do not think that I do not prescribe oral. Oral has an amazing place, especially for women with premature menopause, early menopause, or who just need higher doses. That is going to be a really good way to do that. And honestly, I think oral is a great, convenient option for many women. If you want a whole video on oral HT options, drop me a comment in the link below and I will do one for you. All right, so let's say you're thinking about hormone replacement therapy and you want to do transdermal estrogen. There's two main ways. There's a patch or there's a daily gel. Now there's also a spray called Eva Mist that I really like, but the spray and the gel are so common. A lot about what I say in benefits of the gel are going to apply to the mist, so keep all that in mind. Remember, if you have your intact uterus and you are taking estrogen, you should be on progesterone, and that is to protect the uterus from uterine precancer or cancer from what we call unopposed estrogen, estrogen without progesterone. And the dose of progesterone that you need depends on the dose of estrogen that you are on. So these two are really popular. Let's start with the patch. So the patch is really convenient. Sometimes I call it the gateway into hormone therapy, because it's really easy to put on your skin. And especially if you're like many women and you've gone through the majority of your life without needing lots of doctor's visits, except for maybe outside of obstetrics. A lot of women get to perimenopause or menopause and they'll say, I'm just so anti-medication, or I just don't want to take medications. But we get over that hurdle because adding estrogen is such a natural thing to do. It can improve longevity, it can improve quality of life so significantly that the patch is psychologically a really nice way if you're just kind of not wanting to think about medications, right? It's also great if you don't want to swallow medications or take things orally. You might have ADHD, you can't remember to do things every single day, which a lot of people do, myself included. The patch can be a phenomenal option. There are two types of estrogen-only patches. There is a twice a week or a bi-weekly patch, and then there is a weekly patch. Now, I will tell you that my preference typically is the twice a week patch, because I do think that about by day 5 or 6, the weekly patch is starting to wear off or run out, or it's kind of peeling. However, if you cannot remember to change the patch every 3.5 days, that's really important to keep your level steady, to not have to worry about bleeding, then absolutely go for the weekly patch. The weekly patch right here is a little bit bigger, so it's about the size, probably about this size, whereas a twice weekly patch is about half the size of this, so almost about the size of a quarter. Now, where does the patch go? It's gonna go on your abdomen area. So I always tell my patients right around this midsection of your belly. You can put it here, here, and some women even will put it on their buttocks, especially if they're gonna wear a bikini or they don't want it to show. Now, it can cause some skin irritation, especially if you are fair-skinned, if you're light eyes, if you have latex allergy, anything where just things on your skin tend to irritate you. That can be a negative of the patch. And truth be told, if this is something that you might be doing for years or decades, because there is no time limit to the use of hormone therapy. I have a whole video on that right here. I don't want you having to constantly clean off your skin or have all these red blotches all over your skin. That could be a reason why maybe it's gonna be overall better to switch to the gel. So pros, really convenient. You just put it on your skin. It should stay if you swim, if you shower, and also it tends to almost always be covered by insurance. Cons, if you can't remember to move it every 3.5 days, then go to the weekly. The weekly can be a little bit bigger. Sometimes it can leave marks on your stomach. And one con about the patch is that it doesn't have a timing effect on a 24-hour basis. What the heck do I mean? Well, let's say you're someone who really struggles, particularly with nighttime symptoms. Let's say the majority of your symptoms are night sweats, 2 a.m., wide awake, not sleeping. I might want to time your estrogen for nighttime. And because the patch is continually released, over the 3.5 days or over the week, you can't really time it. So that's getting me into the gel. I might recommend the gel or the spray for someone who doesn't really want to have something on their skin, but particularly when somebody has symptoms that happen to be on an every 24-hour basis that I want to best control. Because you can apply the gel at night or in the evening, let's say if the middle of the night symptoms are really bothering you, or you could apply it in the morning. Let's say if, around noon to 2 when you're supposed to be focusing at work, you're sweating in your board meetings, you're not paying attention, you're losing your memory, your cognition, your recall at work, you might want to put it on in the morning. So the gel is going to give you a little bit more of a way to time release when you really want that peak effect of the estrogen. When you're using the gel, I always say it looks like this little packet. You're just gonna open it up, and I usually have my patients apply it to their thighs, somewhere in the meaty part of the thigh or the back of the knee, and you're just gonna let that medication absorb. In about 5 minutes, all the medication should be absorbed. Sometimes the area can still feel a little sticky. Sometimes that's just actually the alcohol that's still on your skin. But a lot of patients ask me, Dr. Hirsch, is this gonna transfer to my sheets or to my husband or to my kids? And it really shouldn't. I actually recommend, let's say you're gonna do it at night, walk around in your undies, give it a couple minutes, like while it's drying, and then it should all be absorbed so you don't have to worry about it transferring. And this is something that patients really like, especially if they feel like the patch is just not sticking well, it's not giving them steady levels. Let's say they're really big sauna or hot tub people. Sometimes the patch just not so congruent with that. So that can make a gel, something that's just gonna absorb into your skin that much better and really fit into your lifestyle. The downside to the gel is you have to do it every single day. And that can be just another routine you've got to put in your habit. I know how hard flossing my teeth is and putting that in as a habit. So it's something you're gonna have to do every 24 hours. Some women still worry that they might be transferring it, and that's a real thing because, our brain plays a big role in how we function and how we feel. And sometimes it's not as well covered by insurance. It just totally depends. I think, oftentimes it is. Sometimes it's not, but you can always try to do a prior authorization. If you've tried the patch, it caused itching or irritation or didn't stick, and therefore you want to go to the gel or the spray, you can try and have your office do a prior authorization. Okay guys, I hope you found that helpful. Again, I'm Dr. Heather Hirsch, and there is so many amazing clinicians working with me at the Health by Heather Hirsch MD Collaborative. We're a private telemedicine practice in many states, and we know all these little nuances, all these little details. We know that quality of life and something fitting into your daily life is really, really important. And we know that one size does not fit all. So if you'd love to see us, again, links are below. I also have tons of free information here on YouTube, over on my podcast, Health by Heather Hirsch, and across all my social medias. If you found this helpful, give it a thumbs up. Definitely hit that subscribe button and let me know what you think. Are you a patch girl? Are you a gel girl? Are you just dying to get on HRT in general? What are your questions? Leave them below, and I'll see you guys next week for a brand new video. Bye, everyone.